My name's Robert Mandara. I'm an electronic engineer and I'm a bilateral cochlear implant user and Vice President of EURO-CIU. EURO-CIU is the world's largest and most significant federation of CI user advocacy organisations with 33 members in 25 European countries, representing around 220,000 users. The subject of cochlear implants is so important to me that I chose to become active and spread the word so that many more people would get the chance to be freed from social isolation and frustration. Pre-implantation, there is absolutely no way that I would have been on the board of any organisation, being interviewed just like you're interviewing me now. EURO-CIU's policy position on adult implants is that all adults of all ages who could benefit from cochlear implants should be able to have them in conjunction with ongoing support. The problem now is that health systems prioritise children, and adults are usually at the back of the queue. The older you are, the further back you are. And I think it's important for people to remember that most adults are parents or grandparents, so actually failing to implant them has a significant effect on the children and the grandchildren too. EURO-CIU campaigns for adults hearing screening programs so that hearing loss is caught and treated early. The spend to save research shows that society is better off to the tune of about 10 to 1 for every dollar, pound or euro invested in hearing care. So on that basis, funding should never be the problem that it's perceived to be. It is well known that a working cochlear implant user contributes taxes, whereas the unemployed person without cochlear implant drains taxes. There is simply no logical financial reason to deny cochlear implants. Let's invest in helping people to live full, confident and rewarding lives. A life lived socially disconnected is a life half lived. With 2 ears, speech comprehension and direction finding consistently improves. Talking of cochlear implants in the singular just normalises it, and I think it enables policymakers to deprive deaf adults of the best possible hearing outcomes. 2 ears are obviously better than 1, particularly when your hearing is compromised. We're not talking about 1 perfect ear and 1 deaf ear, we're talking about 1 cochlear implant ear and 1 deaf ear. But just as we talk about glasses rather than monocles, we should deliberately refrain from mentioning cochlear implant in the singular. A large proportion of adults in Europe are paying privately to go bilateral. The fact that they are prepared to undergo the operation and pay the high fees only serves to demonstrate how important it is for the users to be bilateral. This is an issue that has been going on for so long. It's not something new and it is nothing to do with money. The decision to deny bilateral implants to adults is simply short-changing society. Deaf patients themselves need to learn from the media how good cochlear implants are. That way the patient, him or herself, can ask professionals for a cochlear implant referral. So patients can take the lead, and maybe patients should take the lead. I think health professionals are not fully aware of cochlear implants. They have not necessarily received training about them, and what they have heard, the knowledge that they do have, is incorrect. It's been gained through old media rather than looking at the situation as it is now, that cochlear implants can restore hearing to a very good degree. The sooner people learn that they may be eligible for cochlear implant, the sooner they are likely to be operated, the sooner they can be reintegrated back to society and play the full role in life that they really want to play. We are social animals, we want to connect to each other. The sooner people are treated, the sooner they are reconnected. I'm having a conversation with you, an easy conversation with you. I'm not saying pardon the whole time. So implants are amazing.